Assalamu alaikum everyone, good evening, and thanks for joining us tonight. I'm just going to briefly whiz through this slide because I want to spend more time with the Q&A really, so hopefully it's about 5-10 minutes, more like 10-12 minutes perhaps, just to whiz through the slides. And just a few of the quick aims tonight. Just going to briefly talk about coronavirus, discuss the vaccines, the ones that are out there, how they work, perhaps some of the benefits from them, and some of the myths and things we've heard about, and perhaps how we can counter that narrative, if that's okay with you guys. Okay, so what is coronavirus? So coronavirus is a virus germ. It's been around for many years. It's not new at all. But we had the first kind of recently, in recent memory, we had an outbreak of a similar bug called severe acute respiratory syndrome, SARS, in 2003, and that was in kind of China and areas around that part of the world. We had a similar outbreak in 2012. And that was called MERS, which is Middle Eastern Respiratory Syndrome. And then this particular bug we have now, this pandemic, is almost like a cousin of the first one, the 2003 SARS outbreak. And that's why sometimes you see it called SARS-CoV-2, which is coronavirus 2. Yeah, it's almost like it's a mutation, a change from the first one. And the change has made it really contagious. That means it's really spreadable. It spreads like wildfire, and that's been the biggest difference. And that's why it spread all around the world as opposed to the first one that stayed kind of local to China. We all know about the millions and millions of cases around the world. There's more than 2.5 million deaths, each one of them tragic, of course. And in the UK, we've had 125,000 and more deaths. So it's a really serious illness. It just gives you an indication of how serious this bug is. Talking about Black and minority ethnic people, it seems to be that ethnic minorities are becoming more ill. More of them are becoming very seriously ill and dying compared to what we would have expected. So disproportionately becoming affected. And we've been thinking about why would that be the case? And perhaps some of the answers may be linked to the kind of the way we live. Ethnic minorities, often you'll find you'll have extended families living in one household, 2 and 3 generations. Perhaps we have congregational prayers and things like this. The kind of jobs we do, often it's public facing. So, a taxi driver is going to see the customers. If you have a shop, you see your customers. Doctors and nurses are seeing patients. So we're very much exposed to the bug. The more people you're mixed with, the more likely you are to catch the bug. And we're finding that these kind of things may be the cause of us becoming more unwell and dying in larger numbers than expected. I think inequalities, perhaps this pandemic has highlighted more inequalities as to why do we have certain jobs and why do we live in certain ways and why perhaps we don't get all the opportunities that other people do. And I think there's a lot of work to be done about that. But certainly we are where we are. And I think from what I've just said there, it seems to me that ethnic minorities have more to benefit from the vaccine, but unfortunately we are seeing people avoiding the vaccine in larger numbers in ethnic minorities, and that's something perhaps we should try and counter, really try and improve. Okay, so in the UK, we've got 3 licensed vaccines. One is called Pfizer-BioNTech. So Pfizer is the company and BioNTech are the guys who did the research. Another one is AstraZeneca, Oxford. So AstraZeneca is the company and Oxford University is where the research was done. You may have heard of AZ. Well, this is the AZ vaccine. Moderna is another one. I don't think it's been used in the UK. I've certainly no experience of this particular one. It's been mainly used in the US and other places. But again, these are the 3 licensed ones in the UK. What do these vaccines actually do? So the coronavirus, it's called corona because it looks like it's got a crown on the outside. It's got these spiky bits on the outside of the bug. And that's why it's called coronavirus. Yeah, these spikes are called spike proteins. And most of these vaccines, what they do is they allow your body, when you have the vaccine, it allows your body to make defenses against those spike proteins that are on the bug. So you have defenses then prepared in your body. Later in life, and in a week, in a month or 6 months, whenever the case may be, if the actual virus comes into your body's already got defenses ready to attack the spike proteins. Now, the spike proteins are on the surface of the virus. So if you attach the spike proteins, you actually do attack the bug. So that way you can get rid of the bug. So it's making defenses in preparation for if you get exposed to the virus in later life. The Pfizer, just talking about the Pfizer one, there was a very large trial of 44,000 people. What they found is after 2 doses, and you have to have both jabs to have the full protection. About 95% of people were protected against becoming seriously ill from COVID, which is fantastic. And this is it's a mRNA type vaccine, which is just a particular technology they use. But ultimately, if you have this vaccine, you are very much less likely to become very poorly and therefore less likely to be in hospital and also die. The AstraZeneca jab, they had a very large trial. 23,000 people is a lot of people. And in a similar way, in these two jabs, and again, they found around an average of 70% of people were you were protected about 70% of becoming very ill. Now, actually, there's a range in the AstraZeneca one from something like 60% up to 90% protection, but on average, about 70% protection by having the AstraZeneca jab. And we will talk about this a little bit more in a minute. The Moderna one, again, is it's about 90-95% effective. It's very similar in the way it works to the Pfizer one, not being used in the UK, but it is supposed to be very effective as well. Okay. So we have all had vaccines. We have baby jabs we give our children. We have travel vaccines and Hajjanumra vaccines, all these kind of things we've all had. And the body in the UK, the government body who signs these vaccines off to say they're safe, is called the MHRA, the Medicines and Healthcare Products Regulatory Agency. They said all those vaccines are safe. Well, actually, these guys are also saying these COVID vaccines are safe. So when we believe them about our baby jabs and your 2-month-old baby, you're willing to give them a vaccine that's signed off by these guys, there really is no reason that we shouldn't believe them about the COVID vaccines either. The JVCI is the government body who decided on who gets the vaccine and which order. As you'll know, the elderly people are getting it first, and we're moving down in different categories. And these guys decided on that. As far as fatwas, I know we have Imam Saab on the call, but perhaps he'll take this up later. But I know many Muslim countries are having the vaccine. I believe Saudi are saying that you have to have a vaccine certificate to go on Hajj and Umrah. So Muslim countries are using it. As far as we know, it's completely permissible and completely halal. So if you have the vaccine, when you become very unwell, it often depends on how much virus is in your body, which we call the viral load. So the more virus is in your body, the more sick you can become. So you might start to get in a fever, you might start coughing. And as we know, when we cough and splurt, we spread germs, and it gets on your hands, and everywhere you touch, you spread the germ. So if you reduce your viral load by having the vaccine, you don't have as much virus in your bug. Often you don't become unwell at all. You don't even know you have the virus, and then you're less likely to spread it. That way, you're protecting yourself from going to hospital. You're protecting your family because you're not spreading it to them. And there are people in our society who can't have the vaccine. For example, at the moment, routinely, we're not giving it to pregnant women. There may be people who have particular allergies to ingredients in this vaccine. They can't have it. But by me having my vaccine, I'm protecting myself. I'm protecting my family, my community, and those people in my community who can't have the vaccine. So it's actually a really good thing to do. There may be some people who say, well, I'm young and healthy and I'll take my chance. I'll build my own immunity. If I get exposed to the bug, I'll become unwell, but I'll make my own defenses. And that is true to a degree. And if you're young and healthy, you might want to risk that. But it's a tricky game because, as we know, some people in their 20s and 30s have died from COVID. And certainly, would you want to risk that with your elderly grandparents and our vulnerable people in society? I think it's a very risky game. There's also some evidence to suggest the defenses that your body makes by getting exposed to the bug perhaps might only last 6 months, whereas the vaccine may last a bit longer. So it's a risky business, a dangerous business. We know there's been some variations, and the bug kind of changed, and we've had a UK variant and a Brazilian and South African variant, and these again have become more spreadable. The change has made them. There's no suggestion that they make you more ill or you're more likely to die if you catch them, but they're certainly more spreadable. But there is evidence that these vaccines do cover those variants as well. Side effects, Well, I had my vaccine and my arm was very tender for 4 or 5 days. And apart from that, I was fine. But things like a slight temperature, an achy body, feeling achy in bed for a couple of days is very common. But to be honest, that's common with any vaccine, really. Any travel vaccine, any vaccination you have, these are common side effects. Anaphylaxis is if you have a very severe reaction, allergic reaction, and that's very rare from what we found from, and there's been millions of cases around the world of the vaccine, and the anaphylaxis is very, very rare. Blood clots, we're going to talk about next. And you've heard all on the press now about blood clots and the AstraZeneca vaccine. So I thought I'd just touch on that, and I'm sure we can discuss it further with the panel in a few minutes. So far in the UK, out of 17 million, the approximate number, 17 million AstraZeneca vaccines that have been given in the UK, there's been 37 people found to have a blood clot. So if you break that down, 17 million and 37, it's around about 2 cases per million. So 2 people out, if you took 1 million people who've had the AstraZeneca jab, 1 or 2 of them have developed a blood clot. Now, if you look at other people in the country, forgetting the vaccine, so people have not had the vaccine, if you just took 1 million 80-year-olds or above, anyone over 80 who have not had the vaccine last year, the year before, around about 3,000 of them develop a blood clot anyway. If you're pregnant, if you took 1 million pregnant women, 200 of them will develop a blood clot independent, nothing to the vaccine. They're just, people develop blood clots all the time. Yeah, it's a very small risk in pregnancy, but does that stop us having deciding to have a child? No, we still have children and we'll take sensible precautions. One of the ways the COVID bug attacks your body is actually it can cause blood clotting. So actually, if you get the bug, almost 50,000 per million people will start having some sort of clotting in the body. So compared to having the vaccine, that's vastly more, 25,000 times less likely to get a blood clot if you have the vaccine. So I would just try to reiterate that it's safe. It's a sensible thing to have. And I think there's certainly the benefits outweigh any harms. Some myths, again, and perhaps we picked this up in the Q&A. As far as I'm aware, and it's not my job to say this, but the ulama and the scholars have said it's completely halal. There's no issue there. I do think when they had the nasal flu came out a few years ago, there's some kind of pork extract in there. I think that put a lot of Muslim people, perhaps Jewish people, but made them cautious about new vaccine. Maybe that's in their mind, but there's no pork extract in this as far as I'm aware. I think some people have asked that this vaccine being made very quickly. Perhaps they've made it too quickly. It's not been made properly. It's undercooked. Several reasons why that happened. One is the volunteers, those 44,000, 23,000 people came forward very quickly. To get 44,000 people on a trial will take years, many, many years. So that because the whole world was at a standstill, I think people wanted to help out. So they came forward very quickly. That saved a huge amount of time. Governments helped funding, they removed obstacles that were in the way. And also don't forget, I said the SARS outbreak was 2003. So research has been happening on the coronavirus bugs for many years, and the RNA, DNA vaccines have been around for years as well. So this is that those previous works have helped these new steps go very quickly. So we've saved a lot of time with that. Changing your DNA, people on YouTube and things are saying if you have the vaccines, you change your DNA. Absolutely no evidence for that, nor for infertility or microchips. It practically doesn't work on the microchips anyway. But there's no evidence for that. These trials were done last summer. So May, June, July last year, 2020. So they've been around for 6 or 8 months now, 9 months. And there's certainly been no evidence of these things happening. 5G and 4G or whatever before mobile phones have been, had bad press. Any new issue happens in the world, there's always an issue about 5G or 4G. So again, no evidence I'm aware of, and perhaps we'll discuss that further in a minute. Talking about the vaccines themselves, 121 million cases of COVID have happened in the world so far. More than 2.5 million people have died from it. So far worldwide, there's around about 400 million vaccines of different companies, not all AZ, all the different vaccines, around about 400 million. And there's not been any deaths that have been proven that have been directly caused by the vaccine. As I said earlier, if you take any point in time, next week, week after, somebody will develop a blood clot. In the same way, unfortunately, people do die every day, and next week, the week after, next month, people will pass away. But there's been no proven link that you have a vaccine that caused death. So 2.5 million deaths from catching the bug, and there's been no proven deaths from actually having the vaccine. That's 400 million vaccines, a lot of vaccine. I think things that we need to do to try and counter this is perhaps discussions like this and opportunities to ask questions, trusted people having the vaccine, our imams, the GPs, other people that we trust and take their word. I think having them having the vaccine is useful. Education, I think, is key. With Ask Doc, we're trying to counter some of these negative messages with the messages in different languages, trying to perhaps give our opinion on what's happening, the truth from where we stand as medics and other specialists in these areas. I think we need to build trust in communities as well. I think trust has been knocked over the last few years with Brexit and other things happening, and the inequalities perhaps being highlighted. I think trust needs to be built perhaps on a wider scale. To help people believe the people who are offering the vaccines. Other things that can be done is clinics in comfortable settings. I believe people at mosques, churches, community centres are starting to be used for vaccines, and I think people perhaps feel more comfortable there, and that's one way to up the number of certainly ethnic minority vaccines. I was involved in a clinic in Bury where I work, and it was very much appreciated. I think it was well received. I think redressing health inequalities, I believe there's a lot of work going to be happening on this over the next couple of years. And I think that's really important because we've had COVID now, we'll have something else in the next few years. These things are unpredictable, but predictably unpredictable. Something else will happen where inequality will be highlighted. And I think it's our job to all not let this, just go into the background under the carpet. We need to work on that. Apologies for going through so quickly because I really wanted to leave it for the Q&A part. But yeah, any questions? I'm going to hand it back to Dr. Inam to take over from here. Thank you for listening.